All right.
Okay. Hi.
Hi, Gail. How are
Hi,
you?
I'm good. I'm
Good,
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 Michael.
good.
Okay, so today's topic is going to be on Kleenex and hugs.
Normally, you'd say, "Oh my God, hugs! What could be bad about a hug?"
Yeah, well, let me tell you something. When someone is in the middle of a cathartic, a true emotional cathartic, the worst thing you can do is do a hug. The second worst thing you can do is move the Kleenex box and hand it to them.
Well, why? I mean,
Be-
what does it do when you hug somebody?
because it breaks their emotional reaction to
I,
what you have asked them.
I actually think it does even worse. It stops
Mm-hmm.
the emotional reaction. And they may never get back to that,
They
which
generally don't.
which is the problem.
Yeah.
Years ago when we were doing group, it was common for people to pick up the box of Kleenex and shove it at somebody.
Right, exactly.
Part of it was because it was about them
Mm-hmm.
and that their crying or their potential need for a Kleenex was bothering them. And there was a couple of times where a person would say to me, "Michael, pass the box of Kleenex. She needs it." And I'd say, "She knows where the box of Kleenex is."
Yes.
I said, and sometimes we use that as a teachable moment and just say, "You know what, did you know where the Kleenex box was?"
I can remember in training, the therapist who was outstanding said specifically to me, because I had moved the box, don't do that.
Mm-hmm.
And he was very, very direct and very specific as to why, because the person's reaction changed. All of a sudden, they became the mature, appropriate adult rather than letting their true emotions
Yeah.
flow. And the conversation changed drastically.
What happens is that it does reflect back to the person who's stopping them that it's more about me.
Exactly. Yes.
And that your crying is bothering me,
Uh-huh.
and that your emotion expressed is problematic for me, and that's just not good in the context of a group. And oftentimes we'll see families will do that just when we're talking with a few people.
Mm-hmm.
That someone will begin to have an emotional reaction. They'll start to cry, and immediately another family member almost dives across the room to console and comfort that person, and
they're not.
and they're not. They're
No.
they're not helping that person. They may think they're helping them because they're wanting to be comforting and but what they're doing is they're saying, "Please stop crying. It's bothering me." The thing that I will frequently tell staff that I work with is that my job is to get people to cry, because what happens is in the tears.
Mm-hmm.
Right behind the tears
Mm-hmm.
is the truth.
Yes.
And when we get to the truth, then we can actually help you.
Mm-hmm.
And until we get there, we're
yeah.
dealing with just a basket of emotions.
Exactly.
And
And hearing from someone, why are you crying? That's another one that has always thrown me. I want to jump across the table and say, please shut up.
yeah,
Just please.
yeah,
You know, that this individual is crying. They want the emotion to flow rather than being constantly stopped, because that's what's happened to them their whole
right,
life.
right. And I think that's where, in our culture, that's what we do, is that we stop people from having a strong emotional reaction to anything, because what I think they think happens is that you lose control.
Well, we want you to. I
well-
mean, that's the issue. Lose control.
But
As
actually,
you said, Michael, the truth then comes out.
right. But it actually, I think that people, they gain control over their emotions and they actually find out what's going on. One of the questions that I would frequently ask people is, how long did you think that the crying would go on? Because sometimes people think that it doesn't stop, that they're inconsolable, that the crying becomes wailing, becomes more. When in reality, everybody pulls themselves together because they recognize, I've needed to do that. That felt so good, and that frequently people that will be energy that will be taken out of their body so that they can actually move on to some solution. And that's really where people want to be, is they want to be in the solution.
In the solution. And quite often, Michael, men are more in control of their feelings than women are. Women will have a tendency of crying at the drop of a hat. Sometimes, not always. What have we got there? Okay. Sometimes not always appropriately. The female that gets hysterical on a regular basis is not, that's not what we're talking about. They need to be stopped, especially if it's interfering with the patient who is going through a difficult period of time. When you have a whole group of family members hovering around a room or a bedside, you don't want the hysterical daughter or aunt or sister, or, but you also want the male to participate with their emotions naturally and normally.
So, the bottom line is allow people to have some tears. It's important for you to be respectful of the fact that people are going to have an emotional reaction. People are going to cry, and that you should give them some time before you interrupt that, because it may stop on its own, which is really better.
Right.
But if you feel that it's not going to stop, you'll be surprised at how much time actually has to pass before you feel that it has to stop.
Yeah. Well, quite often too, the individual who is having emotional cathartic will reach for the Kleenex box to bring themselves under control.
Right.
They want that second or two to calm down, and of course, blowing your nose is you can't really do both.
The other thing that I think goes on to this, and we may talk about this in another video, is that to allowing for silence after that. It's important for people to be able to sit in the silence and collect themselves before anybody speaks, including the therapist. There's a tendency to want to fill the void, but I do think we should talk about that in another
Okay.
video.
Well, I was just going to say that a good therapist will hold the silence, and that's someone who is experienced with this kind of grief.
Oh yeah, absolutely.
But quite often, you're going to have somebody in the room that's going to want to stop the whole process. I'm not sure how to handle it, Michael, and I'm sure most people listening to this don't either. When you do have a family member who's a bit out of control and forcing the attention on them, what kind of advice could we give as to how to shut that individual down without, causing World War II?
I think it is about the amount of time that you allow that to go on. I don't think that there's an uncomfortableness that comes with it going beyond a certain time. And that's where I think that people should stop it, because if it's getting uncomfortable, and it's not the patient.
Yeah.
If it's a family member who's really may want to take it outside, that may be, an opportunity where it does begin to feel uncomfortable. Certainly there are, there's certainly some cultural differences and things like that where, you may want to allow things to go on a little bit longer. But at the end of the day, if it becomes so uncomfortable for everybody, then it's time to stop that. But still, we have to make sure that we've allowed it to go on for
a period of time.
enough time.